to Wellbeing Wednesdays, our new virtual learning series bringing the best minds in healthcare to your digital doorstep. In this inaugural episode, we will discuss the election's impact on behavioral healthcare, the important issues facing Congress in 2021, and the future of our field in a COVID-19 world. Bailey Bryant, editor of Behavioral Health Business, will moderate a candid and forward-looking discussion between our four panelists. Chuck Ingoglia, President and CEO of the National Council for Behavioral Health. Raina Taylor, Vice President of Public Policy for the National Council for Behavioral Health. Brianna Ely, Healthcare Reporter, Politico. And Carolyn Bai, Associate Vice President of Client Services for Morning Consult. To start things off, here is your Wellbeing Wednesdays moderator, Bailey Bryant.
Welcome, everyone, and happy Wednesday. Thank you all so much for tuning in. Before we dive into today's event, I want to go over a few housekeeping items. First, to engage with your fellow attendees, you can use the chat box feature on the right side of your screen. Also, I want to let you know that we'll be conducting a couple polls during this town hall. Once we launch those, a box will pop up on the right side of your screen, and you'll be able to submit your answers there. Now, without further ado, let's kick off today's discussion. Where does healthcare go from here? As I'm sure you all know, we just emerged from an election that could have a profound impact on healthcare in America. And due largely to the pandemic, healthcare was a top issue in this election. First, I'd like to ask our brilliant reporters and researchers on this call to help establish some context for our discussion. Brianna, in retrospect, how important was healthcare to voters in 2020?
Sure. Well, health issues have traditionally been a priority for voters, basic things like healthcare costs and prescription drug pricing. But it's no surprise that the pandemic really did become a top issue on voters' minds in the election this year. Politico and Harvard did a poll ahead of the election, and we found that about a third of voters ranked the COVID response as their top issue on their minds and factoring into their votes in November. And so one interesting thing we found that maybe also isn't super surprising was that it was very deeply partisan. So Trump supporters tended to really think that he and his administration have done a really great job responding to COVID, whereas just 6% of Biden supporters said the president was handling the pandemic well. For independents, though, it did tend to favor Biden. The Trump administration has received quite a bit of criticism for the pandemic response as case numbers continue to rise and the pandemic worsens. So we really did see that play a huge role in this year's election.
Caroline, I wonder if you could follow up on that for us. Is that in line with what you're seeing from voters?
Yeah, certainly. I mean, for the past few election cycles, healthcare has been a top issue right up there with the economy. In this election cycle in particular, we saw healthcare rise as a top issue, not just because of COVID, but also in the wake of the death of Justice Ruth Bader Ginsburg. We saw that Democrats were able to move the discussion in the wake of the justice's death to be about the Affordable Care Act and protecting pre-existing conditions. And with that, we saw a corresponding rise in healthcare as the top issue for voters. Since the election, we've actually asked voters about what their priorities are for the next administration as well. So just this week, we asked voters, what is the issue you want the next presidential administration to immediately address? And we asked this as an open-ended question, so not forcing people into a single bucket like healthcare or the economy or national security. And then using a natural language processing tool, we coded those open ends into various buckets. And the four buckets were very clear. Voter priorities for the next presidential administration to immediately address are the COVID-19 pandemic, racial justice, healthcare, and the economy. But I also want to add a little bit of nuance. It's important to note that while we bucket these using our natural language processing tool, a lot of respondents mentioned two or more of these in a single sentence in that open-ended response. So they'll say the economic impacts of COVID, or getting affordable healthcare because I was laid off during COVID, or the underlying racial disparities that COVID has revealed. So while in the polling world, we really like to give a clean percentage point, it's important to also understand how interconnected and nuanced these issues are for voters. So yes, healthcare was important in the 2020 election cycle, and it continues to be important for voters, but it's hard to not see healthcare as connected to so many other issues in this moment.
Definitely. And I think a big part of healthcare that's important right now is behavioral health. Obviously, we've seen this pandemic worsen the nation's behavioral health. We're seeing rising rates of overdoses. We're seeing more suicides and suicide attempts. So I know that that is a really important area for our discussion today. So I want to throw the next question over to you, Chuck. I'm curious, the pandemic, obviously, it's changed the way people live. And we also, like I said, know that it's had this profound impact on the mental well-being of Americans. Since you've been in the field, can you remember any other time or event affecting the well-being of Americans so dramatically and so profoundly?
Well, it's a great question, Bailey. And certainly, when we have other natural disasters or economic downturns in our country, we see spikes, right, in behavioral health concerns. I think what's really transformative about COVID, right, is that this is affecting the whole country. So this is not a particular location or a couple of states that are experiencing a disaster, but all of us, right, all of our lives are disrupted. And that is causing, kind of this ripple effect of anxiety, depression, substance use, which needs to be addressed.
Definitely. So what has that meant for not only Americans, but the behavioral health providers trying to treat these folks?
Yeah. So, it's, unfortunately, our system for preventing and treating mental illness and addiction in this country has been underfunded for a long time. We were just beginning to recover from some of the cuts that occurred during the last recession, just getting back to, kind of underfunded, kind of status quo. And what I'm really concerned about is that COVID has the potential not just to further fray, but to really destabilize our system of care. So because of the stay-at-home orders, all behavioral health organizations around the country have had to radically change how they deliver care, how they support people in need. Fortunately, states and the federal government very quickly allowed telehealth as a lifeline. But not all services, not all populations, can access care through telehealth. We have diversity in the parts of the country as to how much access they have to broadband. Certain types of modalities don't work. So our members, on average, are reporting about a 20% reduction in revenue. They're laying off staff and closing programs, and as a result, they can serve fewer people at the same time that we know there's increasing need.
Definitely. And I know that this is something the National Council has been looking at, how behavioral health providers have been affected through all this. And so many organizations have responded to your polls and said, we are really struggling financially. We're not sure how long we can keep that up. So definitely an important area to address there. So I'm curious if anybody here has a personal story that they'd like to share to illustrate how difficult 2020 has been for all of us, whether it's a struggle with anxiety or election stress or Zoom fatigue or working at home with kids.
Well, I guess I can take that one, Bailey. I think we have all experienced anxiety during COVID and an additional stress. As a working mom with two small children who are learning virtually at home, it's a constant struggle. Am I being the best employee I can be? Am I being the best mother I can be? What if I did this? What if I did that? And it's a constant kind of repetition that goes through your head of how am I going to survive this? And then what I think is the most important is to realize I'm going to survive, but I'm not going to be the best on either side. And what's the most important is that I talk about it, and that we all learn to sort of talk about what's going on in our lives with each other, so that we're open about it. And we realize when, the stress is just so much that we need to reach out to someone else. And I think that's what we really need to take away from this is that, we're all experiencing stress in our own ways, but let's discuss it with each other, because that's the best way for us to continue communicating and make it through together at the end of this.
Definitely. And I think that maybe one positive is that more people are seeing these mental health problems. They're getting more attention amid the coronavirus. And hopefully that translates down the line to policy changes. As we've said, those are very important. So moving on here, I want to talk about those policy changes or policy implications that we are expecting to see in the year ahead. Our theme today is obviously the impact of the election on healthcare, behavioral healthcare, and substance abuse. So let's try to peer into our crystal ball a little bit and address the implications of the election on healthcare policy to the extent that we can. Raina, I wonder if you could start us off by sharing your thoughts about what this will mean for behavioral healthcare providers specifically, and the organizations that provide those services and substance use disorder treatment when we have this new administration take over in January. Do you have a sense how things will change yet?
Well, we're starting to get a glimpse, and that started through the campaign as President-elect Biden was sort of unveiling what his process is for the future. But it started back when he was Vice President Biden. He'd been a champion for efforts to implement federal mental health parity and improve access to mental health care. He also was a champion in eliminating the stigma around mental health. And so what we've seen from this campaign promises is that he's going to double down on these efforts, meaning that he's going to enforce the parity laws that currently exist and try to integrate mental health and substance use disorder treatment with kind of primary care. And that includes expanding community-based programs. He personally mentions the successful certified community behavioral health clinics, or CCBHCs, as a way to expand community-based care that ensures evidence-based, high-quality behavioral health services in the community. He also realizes that we are in a workforce shortage, that we need to increase the number of healthcare professionals to meet the need that's coming forth, that we're even seeing in our surveys as an increased need for both mental health and substance use services. So what we're hoping is that now President-elect Biden uses a skill that he is very attuned to, which is reaching across the aisle, making sure that he knows that mental health does not choose a political side. It is not Republican, it is not Democratic, but that we have to work together to make sure we take care of those in need in the community that have mental health or substance use service needs. And so what we're looking for is for him to implement what he's promised in his campaign. And what he's promised is to take action on mental health, to bring it to the forefront, and to meet the needs of those in the community with mental health and substance use.
Yeah. Brianna and Caroline, do you have any insights you'd like to add about how healthcare policy will likely be affected?
Well, one thing I want to add just on the behavioral health policy and what we could see maybe more immediately in the next COVID package and sort of part of the COVID response efforts is some of the actions that the current administration had taken in the emergency response, like Chuck had mentioned, expanding access to mental health services through telehealth. The administration had been talking about making those things permanent. It's possible that the incoming administration may also look into that. It's been discussed on Capitol Hill as well. So that's a big thing that could happen fairly quickly. And then another thing is just sort of there's a number of issues in the future that will really determine what happens with health policy this next year. And that is looking ahead to the Georgia Senate runoff elections in January to determine control of the Senate. And I think that will really largely give us an idea of how much can really be accomplished in this coming year, especially in regards to the Biden administration's legislative priorities. Obviously, they have said that the president-elect has said that he wants to do a public option. That would become increasingly less likely if Republicans retain control of the Senate. And then another thing is to decide or to see what happens with the Supreme Court decision around the Affordable Care Act. In about 6 months or 7 months, but I think that will also kind of give us an idea of what policymakers will really be able to accomplish in the coming year. So,
yeah, and I can tag team off of that. I mean, it really is, everything is so dependent on Georgia right now. But under the assumption that Republicans can win one of two runoff races in Georgia, we're looking at the prospect of divided government. And when we think about divided government, we need to think about where there might be common ground. And so for me, I look for issues in healthcare where voters of both parties want to see action. I think 3 examples that come to mind that have bipartisan support. One is behavioral health. We've done this research with the National Council, and we know that behavioral health issues, addiction, are not issues that just hurt one party or the other. They're issues that cross party lines, and as a result, I believe that there are bipartisan solutions. The other 2 issues that one of them has been brought up. I think telemedicine is an issue where we can likely see some level of bipartisanship. And then the last thing I'll reference is just rural health systems at large is an area where I think we'll be able to see some bipartisanship. But we also have to think outside of what Congress may or may not be able to get done. There will likely be executive orders that President-elect Biden's administration will try to take. So we're probably not going to see big pendulum swings in our healthcare system through executive orders. But what are the things along the fringes that might be able to get done? I think one example that comes to mind for me there is Biden can lean on executive action and use regulatory authority to shape some of the drug pricing policy within Medicare in particular.
Okay. So any other executive action examples that you could share with us?
It's tough because I think most of what the Biden administration has put out there as their health policies prior to the election were actions that really relied on having Democratic control of all 3 branches of government. And I think the public option is honestly one of the biggest promises of his campaign and policies he ran on. And I don't see that happening. I think you're looking for little actions around negotiating for prescription drug pricing, potentials for, looking to see whether or not there's any pricing that we can handle with international pricing and whether or not we can match pricing. But I'm curious if Brianna has additional thoughts on that as well.
One other thing I think that we'd likely see from the Biden administration is more action around supporting enrollment efforts for the Affordable Care Act, something that we saw the Trump administration dramatically scale back investments around enrollment outreach to people. Obviously, the Biden administration will want to support and bolster the Affordable Care Act in any way that they can. So I think that is one really quick, easy thing that they would be doing right away. So.
And I would say
Definitely.
That's really important for people with mental illness and addiction, right? Because we've seen some erosion of the essential health benefits during the Trump administration, allowing more flexible health plans. And I think the Affordable Care Act really moved us forward in this idea that mental health and addiction should be treated just like the rest of healthcare, and that comprehensive benefits need to be offered. So I think that's a huge importance. I also think, Raina mentioned something about enforcing parity. Here we are, 12 years after the federal parity law was created, and we're still struggling for it to have its full impact so that people who have private insurance and experience a mental health or a substance use challenge can get the level of care that they need easily, quickly. That is really important to continue to make sure that that law reaches its full potential.
And you think that's something that Biden will have an eye on and seek to do?
I think so. Certainly, the Obama administration, really invested a lot of effort in that area, making sure that there was quite a bit of enforcement activity. So I think it is, kind of fair to say, and certainly will be an issue that we'll bring up with the transition team and with the new administration.
Definitely. So it seems like a lot of this is dependent on Georgia. So we're somewhat speculative right now, but we mentioned this a couple times now. The public option has been something that Biden has talked about at length, but I'm not sure what that would mean for behavioral health providers. Obviously, it's contingent on support from other arms of government, but I know that Medicare for All has been not the favorite option for some folks in the behavioral space because, of course, Medicare has some problematic elements when it comes to behavioral health. So, in this hypothetical, what would or could a public option mean for behavioral health providers?
Well, I think, Bailey, if it was a public option that was just a straight up offering of Medicare, yeah, I think that we would have some concerns, right? The Medicare benefits for mental health and substance use are not only fairly limited in terms of the types of services that you can access, who can provide those, and so if we ever move into have an opportunity to have a legislative discussion about the public option, I think we for sure would want to weigh in to make sure that there are better options for people who have mental health and substance use challenges.
Yeah. So kind of seems like it's a little too soon to know what it would mean. We'll have to wait on that one, I guess. Okay, so attendees, I think we are coming up on our first poll question for today. So again, a reminder, I think that will be popping up on the right side of your screen here shortly if it hasn't already. Once we get that up, I will read that to you and give you a couple seconds to answer. The question is, are you optimistic that the new administration will provide greater federal funding for programs to address mental well-being and substance use disorders? So go ahead and take a couple seconds to answer that question. Your options are yes, no, or too soon to know. So I'll give you folks a little while to respond here. It looks like you're optimistic though, so we love to see that. Awesome. So looking at the results here, it looks like 57% of attendees so far are optimistic that we will see greater federal funding for these programs in 2021. And then 35-ish% think that it's too soon to know. And only 8% are those negative Nellies who are not looking as optimistically at 2021. So overall, I think based on our discussion here and these results, I'm eager and cautiously optimistic going into 2021. So let's move the conversation forward a little more and talk policy priorities. So we talked about what we think might happen. Now let's talk about what we think needs to happen. So we want a little more context here. As we mentioned, the overdose deaths are higher now compared to last year because of the pandemic. More people have reported suffering from anxiety, and more young people report that they've considered suicide. In light of all that, I want to ask you guys what policy priorities we need to see and how these trends are affecting those priorities. So, Raina, obviously one big accomplishment that came recently was President Trump signed the 988 legislation last month, designating a national suicide hotline. And that was a big deal. So I'm curious your thoughts on that and what the next big deal will be that you'd like to see from Congress and the administration in 2020.
Thanks, Bailey. You're right. 988, 2021. Yeah. 988, was a big deal. Designating a hotline for both suicide prevention and mental health crisis is a great moment in our history. And so what we do need to look forward to in the next big deal is the implementation of 988, which is set to take place in 2022. So during 2021, what we need to do is begin planning. We need to look at how we can stand up a system to receive all of those in need to 988. As you mentioned, and Chuck mentioned, I think we've all mentioned, we are seeing a significant increase in the number of people that have behavioral health needs. In fact, when you look at some of the SAMHSA data that's coming out, they say as we look to 2021, we will see probably 1 in 3 individuals needing help with behavioral health care. And so as we look to that increasing need, we have to look at how we establish implementation systems for 988, what that looks like in terms of our crisis stabilization system, what that means in terms of those that are in need and call into a call center and then need to continue on the path of treatment and get the services they deserve. So while 988 is this momentous occasion that we should celebrate in our nation as establishing the place where people can go in a mental health crisis and a place to prevent suicide, but we also need to understand how we as a country can use legislation to implement a system that can care for those who call in. And so I think that will be the next big deal coming forward, is looking at legislation that enables the implementation of a system that can care for all of those in need calling into 988.
How heavy of a lift do you think that's going to be? I know there are some other areas where we've seen legislation and it's supposed to happen, but then it doesn't exactly stay on that timeline. The issue that comes to mind for me is the teleprescription, the special registration to teleprescribe certain controlled substances for MAT. So I'm curious, how likely is it and how heavy of a lift is it going to be to implement these changes we need to see to make 988 a reality?
Well, I'll start and then I'll ask Chuck to sort of chime in too. As we look towards the improvements we've seen around telehealth, what we've realized is that we have reached those in need. And what we are going to look forward to in the future as another kind of next big deal is how do we keep the flexibilities that we've seen, as you alluded to, the prescription of OUD medication. How do we keep the flexibilities that we've seen improve the lives of those in need, specifically in substance use or mental health? And how do we ensure that there is high quality access to care via telehealth in those instances? And so what we are going to see is a mixture of both legislative changes that will need to happen as well as regulatory changes that would approach sort of the flexibilities that we've seen and ensure that we are reaching all of those in need, specifically in the rural areas that Caroline mentioned and also communities of color, so that everyone has access to high quality care via telehealth. So, and I hope that, Chuck, I would turn it to you for any further statements on that one.
Well, I still think that the fundamental problem we have in this country is that it's way too hard to get into care, right? You gotta, every single survey that is done of asking people why they don't access care, even one during COVID, was I don't know where to go, I don't think I could afford it, and I don't feel comfortable going. So we've got to address those fundamental problems as a country, right? Why do we make it so difficult? And Raina, you talked earlier about certified community behavioral health clinics and the fact that the Biden, campaign talks about expanding CCBHCs. Just a few weeks ago, there was a presentation during the MAC-PAC, the federal advisors to the Medicaid program, about the Missouri CCBHC demonstration program. and how many more people are now getting care as a result of that demonstration in that state. And I believe one of the commissioners talked about it as, earth-shattering, kind of the changes that we've seen as a result of this program. An earlier version of the COVID relief package, the CARES Act, added 2 more states to that demonstration. But we need this to be a national model so that there are clinics in every community that can serve, not can, will, must serve everyone, regardless of their ability to pay, regardless of their diagnosis, regardless of their insurance status, that people know that they can get care when and where they need it. That's going to be important as our country recovers from COVID, and it's going to be important as we implement 988, right? We got to make sure it's a great thing that it's easy for people to reach out to get help, but we need to make sure that there's help on the other end of the line, right? So it's not just about having someone to talk to, but also that you can get into care when and where you need it. So that's going to require some investment. The great thing that we've seen over time is that the score, how much the Congressional Budget Office thinks the CCBHC program cost keeps going down as they have more data from what they're seeing in states. So that's a good thing. So we hope that we'll have some further opportunities to expand that program. And certainly, we've talked about telehealth, and we need to make sure that we have, kind of corresponding investments in workforce, because that is the rate limiter everywhere, right? How do we make sure we have enough staff?
Definitely, that is the age-old question that people are trying to figure out. So hopefully we see some brilliant answers and solutions come up in 2021. Brianna, I'm curious what your expectations for healthcare legislation are in 2021. Do you see any appetite or funding left to tackle things other than the pandemic, frankly?
I think that if there is funding that goes to other priorities, it might get, it might get wrapped up in the next COVID relief package. That might be the best vehicle for it, honestly, for some funding for behavioral health to get it quickly to people in need. And then, like we discussed before, legislative priorities kind of do depend very largely on what happens in Georgia. I think we could see some incremental things, though we have to remember this is all in the backdrop of a major global pandemic. And so there's likely things like surprise billing legislation that will get pushed again to the back burner as it had in the fall and in the summer, just simply because everyone is focused on coronavirus and it's getting worse, not better. So I think that that's going to dominate at least the spring legislative calendar. We might see other things move, but I think that that's going to be the main show in town. So
I guess I don't want to say the positive, but the fact that behavioral health has gotten so much attention as well in light of the pandemic kind of bodes well for the fact that there is all this attention on solving the pandemic and the other problems that it's created. So kind of in that same vein, Caroline, I'm curious if voters would support funding for behavioral health and substance use programs, especially in light of all the data that we've already discussed on this call that says that there is an increase in overdoses, suicide attempts, anxiety, etc.
Yes, the short answer is yes. Voters support further funding for mental and behavioral health as well as substance use programs. And we just came out of the field with a poll for the National Council this week. And in that poll, we saw that 57% of voters think that the country is on the wrong track when it comes to addressing mental health and addiction during COVID. Thinking about that by community type, 49% of urban adults think we're on the wrong track, while 59% of rural adults think we're on the wrong track. Looking at that from a partisan perspective, we see that 62% of Democrats think we're on the wrong track when it comes to addressing mental health and addiction during COVID. In contrast, 46% of Republicans think we're on the wrong track. But when it comes to support, there is a strong bipartisan majority of voters who support increasing funding for mental health and addiction recovery treatment. And so we see in our poll, we ask whether or not increasing funding for mental health and addiction recovery treatment should be a top priority for Congress. We see that 84% of voters believe that this funding should be a top priority for Congress, and that's 91% of Democrats and 80% of Republicans. So if you're looking for a bipartisan issue going into the next Congress, funding for mental and behavioral health services and addiction recovery treatment are top priorities for voters of both parties.
So that kind of bodes well, considering how contingent things seem to be on Georgia, because regardless of what happens, we're seeing the support on both sides of the aisle. It seems like the behavioral health industry could be in for some positive changes in the year ahead. Would you say that's accurate?
If voters have their way, that's accurate. I would love to hear a little bit more from Brianna and Raina on that, if that's also what you believe. Or Chuck.
Well, I mean, just look this week, right? The Senate passed by unanimous consent a Crisis Stabilization and Community Reentry Act. The House passed by unanimous consent several bills dealing with increasing access to opioid use disorder treatment. And so, I do think we'll see well, for sure, we have opportunities to incrementally see improvements. And I think the outcome in Georgia, I think, has the potential. Will we see bigger, right? Do we have bigger opportunities? Brianna, would you agree with that?
Definitely. Yeah, I think, like you said, there's obviously bipartisan support to do something incremental, but to actually, invest and pass significant funding, that might be determined by what happens with the control of the Senate. So I think Chuck's right on that. Yeah.
Georgia on our minds, I guess. So we'll have to keep an eye on what happens there. But just a couple more questions here on these policy expectations and priorities. I'm curious, Chuck and Raina, in your view, what would be the best response from Congress to address all these trends? We've touched on it a little bit, but I know, of course, the National Council always lays out their policy priorities for the year ahead. So really curious what you guys have on your agenda.
Sure, I'll take that one. So I think, our agenda aligns up a lot with what we've seen from the Biden campaign, meaning that, we we do want to make sure that parity is enforced. We do want to make sure that as we are looking towards the ACA, that we are ensuring mental health and substance use is an essential health benefit. And so whether or not we can figure out ways to further the parity law in terms of its implementation, and then also looking towards expansion in the communities. I mean, Chuck talked about the CCBHC expansion. We've got to look legislatively to make sure that our system, our community care system, is built and strong enough to endure what we're going to see come forward. And so I think that is going to take a legislative movement. And, Chuck just mentioned the passage of the Crisis Stabilization Act on UC in the Senate. What that means is that we are looking towards standing up a system for those in need in the community, and specifically those in the criminal justice system as they reenter society, to make sure that we are taking care of those with mental health or substance use issues that have been identified while in the system, and so that we can hopefully keep them out. And so as we're looking forward to legislation that both protects those in the community and gives them the services they need, I think we're looking towards a bipartisan support of an administration that's realizing that we are on the verge of another mental health or substance use crisis. Much like the Support Act created both grants and supports to take care of the opioid crisis, we are now looking forward to needing a similar effect to take care of the mental health and substance use crisis that we are seeing from both COVID-19 and the social unrest going across our nation.
I'd just say that the other aspect, the other thing that's in the Biden plan, which I think is really important, is a substantial increase of federal investment for the prevention and treatment of substance use disorders, as well as supporting recovery supports for people who have gone through treatment. We know that far too few people who have a substance use challenge in this country get evidence-based treatment, and we need to substantially increase the amount of resources available for those efforts. And so I think that's something we're also very hopeful for.
Definitely.
We
And
also,
more funding. Oh, sorry, go ahead.
no, sorry. The other thing that just made me think of is that we need to look towards our states, right? Because our states are in a financial crisis as well. And so being able to support them in terms of the mental health block grants and the substance use block grants will also help us stand up these systems and help our states as they are trying to help those in need as well.
Definitely. I was just going to say that funding is really key to solving a lot of the problems that we discussed. Of course, you're not going to be able to keep employees or recruit a lot of employees if the reimbursement and your funding is so low that you can't pay competitive wages. So it's kind of a vicious cycle, but promising to hear that Biden is definitely looking towards more funding for these folks. So that's good news. I think, attendees, that we have our next poll question. So please direct your eyes to the right side of your screen, where you should be seeing that pop up here shortly. This time, the question is, what healthcare initiative do you think is the most important issue facing Congress in 2021? We've got preserving the Affordable Care Act, Medicaid expansion, healthcare costs and reducing prescription drug prices, or addressing the opioid crisis. I'll give you guys a little bit of time to answer those. Oh man, it's pretty split. It looks like I'm watching horse racing or something. I'm seeing all these answers come in. So a lot of folks seem to be concerned about preserving the Affordable Care Act. We're seeing a lot of people say healthcare costs and reducing prescription drug prices. Looks like the ACA is coming out on top. About 50%, about half of all respondents say that's the most important issue facing Congress in 2021, followed by healthcare costs and reducing prescription drug prices, then Medicaid expansion, then addressing the opioid crisis. Do those results surprise you guys? Because I was expecting the opioid crisis myself to be higher up because we always hear so much. Anyone?
Well, I mean, I would say, a couple of things, right? We can't adequately address substance use in this country if people don't have coverage, right? And so what was so important about the Affordable Care Act is that it gave people a pathway to not just affordable, but effective coverage, right? The mental health and substance use were essential health benefits that had to be offered at parity. And so, you can't, that's really important going forward. And the other thing that I would say is absolutely the opioid crisis continues to be important, but I dare say substance use challenges in this country are important, and we sometimes I think we think about it just in terms of opioids, but we know that stimulants are a huge challenge. There's regional variations, but stimulants are a huge challenge. And let's not forget that 3 times more people die every year as a result of alcohol than of opioids, right? So we've got a substance use problem in this country, and we need to make sure people have adequate coverage so that they can get care.
Yeah. I think it'll definitely be interesting to have Biden, somebody whose son struggled with substance use disorder himself, stepping into this role. Hopefully that's reflected in his policies and his priorities on that front. Okay, so I know we could talk about issues all day long, but we're kind of coming up on our time together here. So I want to get into some closing remarks and predictions. So I'm going to ask each of you to share your final thoughts about the election, the impact on policy, or any other issue with respect to healthcare or behavioral health or healthcare policy that's top of mind. And Caroline, let's start with you.
Thank you. Well, first off, I'd be remiss to not just thank the National Council for having all of us today, myself included. It's great to have an event like this. We're close to a year into lockdown here, not full lockdown, but close to a year. And I think it's important that we continue to have these discussions around healthcare and specifically mental and behavioral health. One thing that's kind of my can't let go is just seeing that poll that was just run. I think the Affordable Care Act we probably didn't talk enough about the Affordable Care Act today. And I'm no legal scholar, but obviously the courts are where things can play out, even if there is divided government. And courts can strike down executive actions. And right now we're watching the court play out policy that was drafted in the early days of the Obama administration. And I can't speak about this from a legal perspective, but I can speak about it from a public opinion perspective. And what we've seen is in the lead up to the election, the Affordable Care Act was at an all-time high in terms of favorability. So we saw 62% in September say that they had a favorable impression of the Affordable Care Act and they support the Affordable Care Act. This is of voters. What's interesting is at the same time, the individual mandate continues to be underwater in public opinion. And I will be curious to see if the court ultimately sides with the court of public opinion in their ruling. So that's my last comment that I'll have today. Well, thank you again.
Yeah, well, one note on that. I'm not a legal expert either, but as a journalist, I sometimes talk to them. And I recently spoke with a legal expert on this. He said we should see a decision. The earliest he is expecting to see a decision from the Supreme Court would be spring or early summer. So it'll be interesting to see that decision come out, especially because at that point, President-elect Biden will have become President Biden. So I'm sure that's something we will all be watching with bated breath. Unless there's anything you would like to add there, I'll kick it over to Brianna.
I definitely want to repeat what was said about the ACA. That'll be a huge, important moment to determine what happens in health policy for even the rest of Biden's first term. And then another thing, of course, is just keeping an eye on everything that's happening with the pandemic, because that's sort of the deciding factor in what happens on the Hill and what happens. The Biden administration is going to come into this kind of completely focused on, vaccine distribution, and public health departments across the country are swamped focusing on this. So paying attention to what happens with the pandemic, but then also the consequences of all of the other health issues that have been kind of put on the back burner during this whole year, including the drug abuse crisis or the drug addiction crisis, and seeing that continue to worsen as well. So we'll be watching that very closely and how the Biden administration responds to that. Just getting a glimpse of who Biden has selected to have on his transition team kind of gives us an idea of what they're focusing on in terms of health priorities. I've spoken to a couple members of the transition that are very focused on health equity and making that a priority, especially as we've seen disparities deepen amid the pandemic and amid the drug addiction crisis as well. And so I think that'll be a really big issue to follow along with this year as
well. Okay. Who wants to go next? Chuck or Raina?
How would I go? And I'll let Chuck close us out.
Okay, take it away.
So I think, what we're going to see coming forward, again, it goes back to where we started all of this, and Chuck's mention of our survey data and Caroline's mention of our survey data too, and looking at the services that have had to close down, the number of professionals that have had to be laid off or furloughed, the essential need to stand up our mental health and substance use system in the community to be able to receive those in need as we are coming forward. I think that will be the number one priority in terms of 2021 and the legislation. It's unfortunate that at a time where we're seeing the capacity decrease, that 65% of our organizations surveyed said they had to turn away patients, while we're seeing over a 50% increase in need just now, and you can only imagine what we're going to see in the future, that we have to figure out a way from a policy perspective to further stand up that system across our nation to help all of those in mental health and substance use need. And that starts again with community-based care, whether it's for the first responders or whether or not it's for the recently unemployed that we see an increased need for as well. So I think that will be a legislative priority for 2021.
Well, just listening to the three of you, I'm reminded that there are no shortage of issues that we could work on this year, right? And no shortage of challenges that as our country continues to try to figure out how to make healthcare affordable and be of high quality and accessible, that there are going to continue to be challenges that we have to confront. I know we're not the mightiest organization in DC, but I do think we are laser focused on trying to continue to raise issues of behavioral health to Congress and to the new administration. Hopefully, we'll have continue to have ears in both of those places. And I just want to assure that all the folks that have turned in today, thank you again for joining us, and to just be assured that we will take every opportunity that presents itself to make sure that Congress and the administration understands what's happening out there in communities, the level of need, and we know that that there's a variety of issues. I think Caroline talked earlier about rural voters and their kind of sense about behavioral health. We know, right before we stopped traveling, I was out in Hays, Kansas for a day-long session about resilience in farm country. We know that the suicide rate amongst farmers continues to be very concerning. We have urban problems, that health equity. So all of these things we'll continue to try to focus on to make sure that we have adequate capacity and to make sure that behavioral health, it continues to be part and parcel of all of these conversations moving forward. And I guess just say thank you to all four of you for being part of this today. It was so much fun.
Yeah, I definitely agree. I think we had such great conversations. I love to be surrounded by people who are so much smarter than me. So I think the big takeaways here were the fact that there's a lot of support for behavioral health on both sides of the aisle going into 2021. Obviously, we're going to have to wait and see what happens in Georgia, to see what happens in the Supreme Court with the ACA. But it looks like we are in a pretty positive place with a lot of folks realizing this dire need that exists to help with substance abuse and mental health disorders in America. So I think we'll have lots more to talk about the next time we do this. Awesome. Well, looks like we are almost out of time, folks. So thank you so much, everyone, for tuning in, and be sure to join the next Wellness Wednesday webinar when we do it in a few months.